Well, it has become an event that lots of people in our community put on their calendar each and every year. It's been going on 24 years. The annual Minority Health Fair is coming up. Bill Omer and Gene Settles joins me now with more on this. Gentlemen, always good to see you all.
Same here.
All right, y'all have been doing this for over 20 years.
24 years.
24 years now. Talk first of all about why this is such a staple in the community for so many people.
Okay, but before I do that, I want to thank you for having us on the show. We appreciate the opportunity. And
Glad to have you all.
Omega Psi Phi Fraternity, Kappa Alpha Psi Fraternity, Delta Sigma Theta Sorority, and the Southeast Health Consortium have joined together to put this particular health fair on for the last 24 years. And it's important to improve the health situation of the Chattanooga community. This is a health fair for everyone, not just for minorities. It's for everyone. And it will be held, and it's a free event. It will be held on July the 19th, Saturday, July the 19th. We'll start the day off with an 8 o'clock health walk, and the health fair will start at 9 o'clock from 9 until 1. And again, it's free. We are encouraging the participants, if at all possible, to pre-register. They can pre-register by going to the Hamilton County MinorityHealthFair.com, or they can call this number, 423-778-6598.
And we'll make sure that that information gets shared. And you know, you talked about that and how it got started, who puts this together. Tell me about what you offer when people get out there. And we have some video we'll show throughout this segment of past health fairs, but what can people expect to attend?
Well, you know, first of all, just let me say this and thank Gene for giving that overview. But, you know, for a long time and continuing even today, the leading causes of death, the leading cause of morbidity, illness, continues to be disproportionately held by those persons of color, those persons who are in situations where their finances might not be of such where they can afford adequate medical care. So cancer, kidney disease, diabetes, cardiovascular disease, even mental health now is becoming a serious issue, not just among minorities, but everybody. So, you know, we're going to be having screenings done, new screenings with regard to mental health and depression, new screenings having to do with legal services and the need for legal services, eviction prevention. We'll be having a hearing screening done. We wanted to have that last year, but this year we're going to have that. We'll have a special mobile unit that will be there to do hearing screenings. Mammograms will be given again this year with Memorial's mammography mobile. The lung screening will be done with Memorial's Hospital's lung mobile. Diabetes screening will be offered again this year, stroke screening, bone density, of course blood pressure, always that, and also adult and pediatric dental screening will be had as well. So we're looking for a lot of good things this year. The legal resources that we've been bringing forth are going to be with us this year, asking them to come, and now they're coming.
And that's so good. And I want to just kind of stop you and piggyback and go back to something you said, a couple of topics that I think that, you know, for so long, mental health in the Black community was something that we just overlooked, or we said, no, we can't talk about that. And now you see churches getting it more involved. You see, because you're realizing how real this is in our community.
Exactly right. And we're having a great, the Helen Ross McNabb Center will be having persons there to address mental health issues and screening opportunities as well. Family shelter resources will be there. That's new for us, for mothers and their children. So the prescription drug take-back program is going to be there as well. So bring your outdated prescription medications to properly dispose of. The Sheriff's Department will be there with us as usual to take those prescription drugs that are not being used and dispose of them properly.
So lots of things that I want to get in this last minute, and then also tell people it's also an enjoyable atmosphere when
It's
you
a
go out there. It
family
really
affair.
is.
It
And
is.
you,
It's
and
a
you
reunion.
have some of those groups line dancing out there.
Yeah.
You have people socializing. And you know, we
Yeah.
used to call it a family reunion. And
Yes.
I just always want to say every time I talk about this Minority Health Fair,
Yes.
that you all are continuing to pursue what Dr. Gear
yes.
and Chris Ramsey started.
Exactly,
Yes.
Yes.
exactly. Well, actually, Gene was one of those with Irvin Overton and Dr. Gear. Yeah, so
That's
it
right.
was a great union between the three of those guys, and so they're continuing. We are continuing with their legacy.
And I would like to add that those participants that actually go through the screening, there'll be refreshments and there will be door prizes for those, but you have to go through the screening.
Have to go through the screenings, which are so important because, again, and as we run out of time, just want to say, we always talk about there are people each and every year who they find out something that saved their life
Yes.
right there
Yes,
at the health
exactly.
fair.
But we appreciate the opportunity to talk about this, and if people would pre-register, if you don't pre-register, you can still come. You know, we're
Okay.
just trying to make it easier for you to get there. Don't worry about the lines. Pre-register at 778-6598.
And we have it up on the screen there.
Very good. We appreciate that so much. You can also register online.
Okay, online.
MinorityHealthFair.com.